I'm J.R. Jamison. Today on the Facing Project, I'll explore the everyday impacts of injustice in health through the stories of those on the front lines in Baltimore, Maryland, touching on barriers to care in Black, Brown, immigrant, and LGBTQ+ communities, challenges with mental health and housing, and the influence of identity, community, and culture on well-being. Later, I'll be joined by organizers of the Facing Injustice in Health book project, Mindi, Levin, and Stéphie Dulièpre of Source at Johns Hopkins University, and also by Dr. David O. Fakunle of Johns Hopkins Bloomberg School of Public Health and CEO of DiscoverME, RecoverME, an organization that utilizes the African oral tradition to empower use of storytelling for healing and growth. And I'll share stories from two individuals featured in Facing Injustice in Health who are using their own lived experiences to strengthen relationships between healthcare and communities and inspiring others to do the same. Stay with us. You're listening to The Facing Project, and I'm J.R. Jamison. My first two guests for today are editors of Facing Injustice in Health, a recent book project from the Facing Project Press that was led by Source, a Center for Community Engagement and Service Learning at Johns Hopkins University. Mindi Levin is the founder and director of Source, and Dr. Stéphie Dulièpre served as the graduate student coordinator of the project and is a clinical and public health veterinarian in the Baltimore area. Mindi and Stéphie, thank you for joining me on the Facing Project.
Thanks for having us.
Mindi, I want to start with you. Tell me more about your work at Source and why the story of injustice in health was important to focus on at this time.
Absolutely. Always happy to share more about the work that we're doing here at Source. So Source, we are, as you said, the Community Engagement and Service Learning Center. We serve the Johns Hopkins University's graduate level health professional schools, which are the schools of public health, nursing, and medicine. And the work that we do is really to engage all three of those health professional schools with over 100 community-based organizations here in Baltimore City. Basically, what we're doing is we form mutually beneficial partnerships that promote health and social justice. And it's really our partnering organizations that are the ones that identify opportunities for our students, faculty, and staff to collaborate with them. And all these areas are to give us the opportunity for our students to have a learning experience while simultaneously meeting the needs of our community partners. And a lot of our work really focuses on helping folks understand the social determinants of health, understand health inequities that are happening here in our communities. And because our students are largely in Baltimore, we have this wonderful opportunity to really have deep and meaningful relationships and connections. For us, we've heard time and time again about stories in the community of how people have been negatively impacted. And we always feel that the folks that know best about their communities are the communities themselves. So this gave us an opportunity to really dig deep and identify folks that were really willing to share some personal stories that would encourage others to become change agents and really be committed to working in partnership to bring about positive change.
Mm-hmm. This particular project looked specifically at health injustices that have affected Black, Brown, immigrant, and LGBTQIA+ communities. Stéphie, guide our listeners through the process of recruiting and selecting storytellers. Were there challenges to getting folks to come forward?
Yes, I'd love to. So I guess before even the process of gathering people, I want to take us back to how we set ourselves up from the get-go. We had to set the scene. We recognized the history that preceded this project. We understood there were already existing trust issues within the community when it involved health, even trust issues between community members and even the institution itself. We were very intentional about thinking through and processing what that power dynamic was in terms of who is doing the recruitment and who are the storytellers and how does that factor into how this project pans out. We created a steering committee, and the steering committee's job was to really hold each other accountable, pretty much to all of these intricacies that I mentioned. And the steering committees were representative of, the School of Nursing, the Hopkins Community Connection. So through the School of Medicine partnership, we had public health, the School of Public Health representation. We also had representation from community-based organization, House of Ruth, Maryland. And what I can say is that as we certainly were aiming for a higher representation from our community-based organizations. So we also noted that we did not have, as much of that representation as we like on this steering committee. So that really meant that we needed to be really focused on elevating the voice of community members so that would not as a result, be dampened in the process. So we made sure we had recruitment flyers and outreach efforts, public outreach efforts throughout the networks. We definitely rely also on sources, as Mindi said, over 100 community-based organizations to pretty much get that outreach going, so they can communicate with their own members. And we spent a lot of time thinking and deciding what theme this project should be. And eventually we got to a place where we said, again, this is about recognizing our own limitations here and recognizing where we stood in this process, our positionality. We perhaps shouldn't be the ones deciding what the theme is. And the ones to decide that would be the actual storytellers. And that's exactly what happened. So we allowed the stories to come to help us guide what that theme would be. But essentially, we did a blind review of all the applicants who submitted their responses. There was a time that we thought we may not have enough applicants, so we did more and more outreach. So we continued as much as we could to get a really good representation. But eventually we got to a place where we had a good number and we were able to review the applicants to be able to accept. But we were very focused on ensuring that there was good representation from the Baltimore community. I think some I mentioned a couple of challenges already, but a couple more I want to mention is that on the side of entering into a project like this, people often don't think their stories are worth telling. They perhaps see that this is an opportunity and second guess themselves. They may not think, their particular story is of value. Perhaps they don't trust you as a vehicle to be able to tell that story. And I've mentioned earlier, there's a trust already that we needed to, a trust that needed to be repaired. It's previously been broken with some community members that, will feed into something like this. And another aspect of this is just the personal nature of this. These are deeply personal stories. So people may think that their stories are worthy. Perhaps they may have trust with who's sharing it, but perhaps are afraid because these stories are deeply personal and they may be afraid of who's going to read it and who, even people in their immediate vicinity, because sometimes these deeply personal stories, you're more afraid of sharing them with who's closest to you than you are with strangers, etc. So all these, presented challenges, but where it was important for us then, understanding that existed to create that trust and be really transparent with everybody about the process and how everything would go. Even when things don't go well, we were very transparent about that. And essentially always reminded people, very important, that they were totally in control from beginning to end. That and throughout this process, at any point, any time, they could decide to step away. And we also made sure to ensure that writers provided that space for the storytellers to feel seen and heard and respected throughout. So, it's definitely a learning experience, but rewarding in the end.
Mm-hmm. And we'll hear some of those stories here in a moment from the project. But as you mentioned, the stories, some of them were heavy because they come from a deeply personal space. And sometimes that wasn't a positive space, right? And sometimes people talked about how they worked through that, but sometimes people were still sitting with that pain. And so we heard challenges that they faced, obstacles they've had to overcome, past wrongs that maybe haven't been righted. Could you talk more, either one of you, about what you were feeling as you read these stories?
Sure, I can talk. This is Mindy. So when the stories came in and we were reading these stories, they're very powerful. People are sharing very deep, personal, hurtful scenarios that have really impacted their lives and the trajectory of their lives. And at the same time, they also seem to be pretty cathartic in identifying ways to move forward and wanting to share lessons with other people so they can learn from that. So when I read the stories, I was just so appreciative of people sharing their vulnerability with others. And this became a project that made it even that much more important for us to get these stories told. And part of this that we're doing with this story is that we want to have an opportunity to have dialogue and to critically reflect around people's experiences, because we're talking about people's lives. We're talking about their health and how it impacts every aspect of their lives. And so we at Source are also talking more about how can we utilize people's stories to educate others and have better prepared public health professionals, doctors, and nurses. So a part of this was also very empowering to be able to have such a strong book of stories from people that we're just very thankful to be able to have and share with other people. So I think even members of our Source team that were not on the steering committee are picking up the book and reading and just feeling so deeply connected and being able to say, oh, wow, this really resonates with me for different reasons, because we all have had hurt in our lives. And it brings this opportunity for us to see the humanity of others through such beautifully and powerfully written stories.
Mm-hmm.
Yes, absolutely. And this is Stéphie here. I strongly resonate with what Mindy just said. And, as I was reading through these stories, understanding the depth of what they were sharing with us, but also with the rest of the world, what came to me was an immense sense of responsibility. It was a responsibility to the storytellers, to the writers. It was a responsibility to be able to do all of these stories justice. Not everybody in this cohort had an opportunity to do anything close to this. So they were holding on to these stories very close to their chests for a very long time. And it was an honor to have been entrusted with that and to have been allowed to be a vehicle to share these stories with everyone in the community and at large. So that's why the sense of responsibility was very strong for me personally, and how I carried myself and how I interacted with all of our participants, and even how I share this project beyond the project completion as well. Of course, a sense of pain of what people have gone through. There is a sense of me. I mean, as a clinician, healthcare professional, I there's a part of me that always wants to see where we can help. But often, it is just providing a platform. There's not always that. As you mentioned earlier, there's not always that conclusion to every story. But the act of sharing in itself provides therapy and empowerment to those who can do that. And I sense there was a sense of community for me as I read through the stories, because there were snippets of these stories I could reflect or see myself represented in. some snippets of experiences that shine through that I could connect to. So that sense of community was also strong for me there. And honestly, I have to say, you know, Mindi mentioned this too, but a sense of awe, honestly, awe, because it was nothing short of bravery from on everyone's part to be able to display yourself in this way, to share some deeply personal stories. So that's where I would end it. I'm incredibly grateful, lots of gratitude, but in awe at everybody's power and bravery in going through this process.
I'm always amazed as well at the bravery storytellers have. And as you mentioned before, sometimes people enter this thinking, I don't have an interesting life or that interesting of a story to tell. But then as they begin to work with a writer and build trust over time, the courage, right, to tell their story and the coming out process onto the page is really cathartic in many ways through all the facing projects I've been involved in. So I'm curious to know, have you heard from any of the storytellers or writers, or even from the two of you as organizers on the project or others from the steering committee, any immediate impacts, any nuggets you could share with us?
Sure, that I can start here. So this is Stéphie, and the first thing I would say in terms of nuggets is perhaps not where you're going with this, but I was really surprised at the what is the forgiveness or the gentleness in which everybody not only has gone through the process, but the graciousness in which they allowed, there were ups and downs, and we went through moments where we weren't really sure if the timeline was going to be, we changed the timeline multiple times and had to be really apologetic to people about, expectations. But each and every time they worked with us, and they were very forgiving, and so despite the heaviness of the task at hand, they were so incredibly gracious. So I think that's a nugget that I want to communicate how incredible and grateful I am. But even throughout this process, there were people, once they've gone through the process of talking to each other, the storytellers, the writers, I can tell you there, even in the very, very beginning, when we first initially connected people together, you saw sparks flying in the room about the people who were like, oh my gosh, you're my writer. Like, we connected, and there were people who reached out to us after the initial training. She was like, can I please get this right? Can we please be connected? Like, can this person be my person? And we're like, absolutely. You get to, yes. We love to see those connections. So we saw those sparks early on, and we honored that. And these people went through the experience so excited. And after they were done crafting the stories, they were so proud to be able to display what they've come up with together, and just couldn't wait to see it displayed. And and we had others who this was their first time doing it. They weren't really sure. They relied on us to keep giving them encouragement along the way. And then once they made it through that hump and they've seen the product, eventually they're like, this was all worth it. Some people perhaps didn't fully imagine what it will all look like in the end. And then eventually when they got there, they, were so honestly proud of themselves, but excited that it all happened. But I also want to say that, it's really something to be able to see yourself reflected on pages in a book. After, the society in which we live, unfortunately, has not facilitated the elevation of voices of those who are most vulnerable. So I found that people have seen, going through this process, this as an opportunity to essentially reassert themselves in a space to stand on their own values and their own experiences. So in the end, it becomes just an incredibly empowering effort, but also just the sense of pride that comes with that when people are able to see not only the product of their own work, but themselves reflected back to them in ways that perhaps hasn't been done or allowed before. So, yep.
This is Mindi. I can just add one other tidbit to what Stéphie has already beautifully articulated, and that is the excitement we all had when the books came and are in our hands. And then we're getting the books to our story writers and our storytellers. And a lot of the folks that obviously live very close to us here in Baltimore have been stopping by our center to pick up their books. And people have just been so excited and proud and happy and looking forward to launch and other ways to utilize the book. We have one of the members of our source team who wasn't here when we were first starting the process. So she wasn't involved. And yet, as people are coming, they're like, "Can I hug you? Like, I'm just so excited that this is a part of what you're doing, and thank you." And she has felt extra connected because she's had, this wonderful opportunity to share in this occasion with others. So it's just really wonderful to see the power that this book has already had, and we're just at the beginning.
Mm-hmm. What's your biggest hope for those who read Facing Injustice in Health?
So this is Mindi. And my biggest hope is that more people will take the time to listen to one another, hear and read each other's stories, and really see how much we all have in common and how every life is worthwhile and important, and we need to be protecting one another and supporting one another. We are in a place where we are training future health professionals, and if we are not valuing one another and recognizing the humanity in each of us, we're not going to be great practitioners, but we're also not going to be great people. When I think about all of the ills that are happening around the world, it's also great to hear so many people say we need to spend more time on telling stories and sharing stories so we can connect with one another. And that spirit of connection and relationship building and trust building is so central to the book.
Mm-hmm.
Yes, absolutely. And this is Stéphie here. My biggest hope, I struggle to merge it into one. So I'll kind of give you a twofer, one of which is very much in following on what Mindi said about the recognizing our humanity. I do not want this book or this project to be almost seen as a museum for people to pass through and just observe other people's lives, but a sense of connection. So when people read this, that they truly get the sense that they are connected with their neighbors, their community members throughout this entire process, the good and the bad, for people to perhaps recognize maybe they weren't on the good side of this equation, and a sense of, gain an opportunity to reflect on their own ways in which it can help strengthen our health system or strengthen our community relationships. So so a deep sense of connection and presence is what I hope for people as they read through this. But on the other side of this, I really, really want to elevate those who've experienced some of these so who have shared these experiences, whether the storytellers themselves or people who read the book. I do sincerely hope that people out there who could have been storytellers themselves see themselves reflected in these pages, that they feel seen and heard and valued and respected. Even if perhaps there have been messages or the world at large may not, may not reflect that. But that's my sincere hope, that they see themselves in these pages and realize they're not alone. and that they truly hone in on their power in this process, whether they want to share their stories themselves, or they want to reach out to other people who experience, similar issues and create bonds in this way. But either way, at the end of the process, for that to be an empowerment for people. So that would be my hope, truly, to ensure that people feel seen and heard, and that we all find ways to connect with each other.
Mindi, Levin and Dr. Stéphie Dulièpre, both editors on the book Facing Injustice in Health. Thank you for joining me on the Facing Project.
Thank you for having us.
Really appreciate the opportunity to talk. Thanks, JR.
Yes.
Facing Injustice in Health is out now everywhere books are borrowed and sold. Up next, we'll hear 2 stories from the project, followed by an interview with professor and mental health professional Dr. David Fakunle, who also founded and leads DiscoverME, RecoverME, an organization that utilizes the African oral tradition to empower use of storytelling for healing and growth. Stay with us.
Lifing It in the Community. Carol Glenn's story, as told to Layla Habib, performed by Amanda Hummer. I was my mother's knee child, the child she thought was going to be her last. I knew you was going to be that special child, she always said, recalling that she wanted to name me Demetris. I'm like, what is a Demetris? When I was born, my grandmother heard carolers outside and said, "We gonna call her Carol." Carol means song of joy. I always tell my grandma she saved the day. Being my mother's knee child, I went everywhere with her. When I was 15, my mother would take me to sign young girls up to become secretaries. I knew I was gonna get a special grilled tuna sandwich after, so I started wanting to go with her every day. At that time, women would go to stores to cash their welfare check. My mother would sit up there at the counter and ask, "So you want to do more with your life?" And I watched her change their lives. They would go from being a mom on social service to going to secretarial school and learning to be a part of an administrative team. I remember bulks of young women who would walk in with their heads down, eyes showing they didn't see a way out. But they walked away with hope in their eyes. I wanted to be able to do that, transform people. So I entered the health field, becoming an outreach worker at a time when Medicare waivers allowed elders to see the doctor as much as they wanted to, all with their medications and transportation fully covered. Then, the city cut the waiver. So the first job I had was to tell over 10,000 elders that the waiver was cut. And now, they'd have to pay for all their visits and prescriptions. You know, people don't care what you know until they know how much you care. Then they'll tell you everything. I have a love for people that's truly from God, so I connected with these elders and found out many had nobody. Some said, "I don't have any kids that want to be bothered with me. I think I'm just going to die." Others said, "Now I'm going to have to decide if I'm going to eat dog food and get my medication because I can't afford both food and medications." It was terrible. I would look at them and think, how would I want somebody to talk to my mother? So I went between 5 different medical centers talking to these elders from 1996 to 2005. In this work, I saw the way the crack epidemic tore up our city. The first thing people say to me who were growing up in that time is, "I wasn't always like this." They show me pictures. "See, I used to dress just like you. I used to be able to wear heels like that." I look at them like, I believe you. I believe you. I know what life can do to people. I know this life caught them by surprise. There was nobody in the playground when they were kids saying, "When I grow up, I'm gonna be on the street." So when I see them out on the corner, I know that's not how they thought life was going to turn out. Life happens, and you never know. One client I had was a psychologist. Her center closed because of the pandemic, and she tripped over her little dog and broke her back. She stayed in the hospital so long that by the time she got out, she had a pink slip on her door. Eviction notice. Now she's in a shelter. I call that lifing it. One day you could be up here, and you don't ever know that you can be down here the next. I work on the east side, where there was once this lady, B. Gaddy. Every Thanksgiving and every Christmas, B. Gaddy would get these huge places and feed all the poor people on the east side. It started small, and it grew and grew to the point where stores were giving B. Gaddy free food because they knew what she was bringing to the people. Then all of a sudden, after about 15 years, B. Gaddy died. Everybody was like, what did she die from? Breast cancer. Because B. Gaddy was this little black woman that was so consumed with the people, she never thought about going to the doctor to take care of herself. She could have went anywhere for free because that's how much this city loved her. By the time she went, it was too late. Back in the 2000s, they were trying to figure out why more Caucasian women got cancer, but more black women died from it. I hit the street and found out a lot of black women were taking care of their grandchildren because their children had been caught up in the crack epidemic. These grandparents became grandparents before they even reached the age of being a grandparent. So a lot of them didn't get around to feeling if they had a lump until it was too late. So I got out there and beat the ground. I went into churches, projects, and medical centers, talking with women about the seriousness of a breast exam. Looking back, I didn't think I was going to become a community health worker. But I realized that I've been ministering since I was a little girl. I started out speaking in church, and I never knew it would turn into me speaking about health. Through it all, I just hope to help people find a new lease on life, or at least a moment to smile. I love seeing people smile, so I try to get people's minds off of something for just a few minutes and make them smile, trying to live up to my name in a way, give them songs of joy. Trust, whatever God has put you on this earth to do, it's going to be fulfilled throughout your whole life, constantly. You watch.
Chasing Shadows. Zev Saquon Manka's story as told to Preeti Shakia. Performed by Jalen Vachita. The first time I truly felt the weight of my race while seeking healthcare was when I saw different prescriptions for my ADHD. Diagnosed with ADHD as a child, the medication I was prescribed had adverse effects. It made me lose my appetite, lose emotion, and feel jittery. My heart raced, almost as if it was going to beat out my chest. When I expressed my concerns about the medication, my experience was minimized. Everyone goes through it, the doctor said. Your body has to get used to the drug. But my body never did. I eventually stopped taking the medication and was left to navigate school and life on my own. Philadelphia is where it all began. The city's vibrant and bustling streets were my home. However, beneath the surface of its lively neighborhoods, my childhood unfolded in a broken home. The marks it left are invisible but run deep, etching silent scars onto the canvas of my soul. I was adopted in Philadelphia and moved to Vermont. Vermont was a stark contrast to Philly. The vibrant streets of my hometown were replaced with the serene, quiet landscapes of Burlington. The color contrast wasn't just in the scenery. It was in the faces around me,
and the experiences that shaped my new reality. I was Black in a sea of people who did not look like me. Philly and Burlington felt like two different worlds, but it was in Baltimore that I found my calling. When I moved to Baltimore, at the age of 19, it felt like coming home in many ways. Morgan State University became my sanctuary of learning. With each lecture, each discussion, I found fragments of myself mirrored in the faces of my professors and peers. Surrounded by Black scholars and mentors, I felt a deep sense of belonging. I wasn't just another face in the crowd. I was part of a community that understood me. There I found my footing. I earned both my bachelor's and master's in social work. But studying there wasn't just about getting a degree. It was about understanding my roots and finding my purpose. At 26, like many young adults in America, I aged out my parents' health insurance. Suddenly, the safety net was gone, and the ground beneath me felt uncertain. For the first time, I was dealing with the healthcare system without assistance from caregivers. Specifically, my white adopted family. Before, they were a buffer to the barriers. Now, booking appointments became a nightmare, a cycle of endless rebooking and unavailable slots. The dismissive nature of healthcare professionals, coupled with the pervasive attitude of, "I know better than you about you," created an environment where seeking care felt daunting. The quest to find a doctor who looks like me and gets me has been nearly impossible. It's an experience many in the Black community share. We rely on word of mouth, whispers in the community about which doctors might actually care. Finding a Black physician was like finding a needle in a haystack. On the rare occasions I've had a Black doctor, the difference was night and day. I felt seen, heard, and empathized with, a stark contrast to the usual indifference. It's a feeling I wish I could bottle and share with every Black patient who feels invisible in the healthcare system. In the Black community, health is often a matter of survival, not wellness. Preventative care is overshadowed by immediate needs, and healthcare-seeking behaviors are fraught with mistrust. We've been let down too many times. I remember my grandfather being diagnosed with cancer, but he denied his second round of chemotherapy due to how it made him feel and the lack of empathetic care he received. As a Muslim, his needs were not respected during his hospitalization, including the times a day he needed to pray. This lack of cultural sensitivity and understanding is a story all too common among Black families. Black women have it even harder. I remember one time when my ex-girlfriend was writhing in pain. The ER doctors insisted she was pregnant. She wasn't. Her appendix was about to rupture. Her heart stopped on the operating table before they finally recognized the true problem. She underwent an 11-hour surgery and narrowly survived. It's a story too common among Black women. Misdiagnosed, mistreated, overlooked. The system is rigged against them in ways that are both subtle and glaringly obvious. It's like they couldn't see her pain because they couldn't see past her skin. My experience with healthcare improved drastically when I transitioned to work at Johns Hopkins in 2022. The network widened. Resources became more abundant. Currently, I serve as a student and family engagement manager at the United Way of Central Maryland, a role that brings me immense joy and purpose. Every day, I see the long-term impact of my efforts, and it drives me to continue advocating for those who need it most. However, amidst this transition, I find myself still grappling with the challenge of finding a primary care physician. Just as I was establishing a relationship with one, my job circumstances abruptly changed. Even with my education and decent income, navigating the system is like walking through a maze. If it's this hard for me, how is it for others? I wonder. My story isn't unique. It's a thread in a much larger tapestry of racial injustice in healthcare. Each thread tells a story of perseverance, of navigating a system that seems designed to exclude us. We're tough. We persevere. but we shouldn't have to fight this hard for something so basic. I work for a day when our community doesn't have to jump through hoops to receive the care we deserve. When representation in healthcare isn't a rarity, but the norm. Until then, I keep pushing, advocating, and doing my part to make sure the next generation of kids from neighborhoods like mine have better odds than I did. My work, my purpose is to change this, to make sure the next generation doesn't have to tell the same story. As they say, the system isn't broken. It was built this way. But that doesn't mean we can't rebuild it, piece by piece, with empathy and understanding at its core.
I want to welcome to the show Dr. David Fakunle, who is an assistant professor of public and allied health at the Morgan State University School of Community Health and Policy and associate faculty in mental health at the Johns Hopkins Bloomberg School of Public Health. David is also the co-founder and CEO of DiscoverME, RecoverME, an organization that utilizes the African oral tradition to empower use of storytelling for healing and growth. David, thank you for joining me on the Facing Project.
JR, thank you for having me. I appreciate you.
Recently, I watched a TED Talk you gave about the late Mary Carter Smith. She served as Maryland's official griot and the host of a radio show called The Griot for the Young and the Young at Heart that broadcast on our sister station, WEAA, in the Baltimore and Washington area from 1975 until the year 2000. You were a young listener of that show, and its influence shaped the trajectory of your life. Tell me more about the impact Mary Carter Smith's program had on you as a young listener and how she shaped her story.
So Mama Mary's story was shaped by love and all the different moments in her extraordinary life where she demonstrated love, oftentimes where there was reason not to. She was a woman that was shaped in many ways, not exclusively, by tragedy. And those were the moments where her love shined strongest. And it also came through her storytelling, not just of her personal narrative, but of the many folk tales from the continent of Africa that she learned from the continent of Africa and brought back to the United States in many ways, including the Griot for the Young and Young at Heart. And so Mama Mary was a woman of short stature, but she told big. And that came loud and clear over the radio. And it definitely came loud and clear when I ever saw her perform in person. And so that was very much infectious. And that infectiousness showed up in a moment of serendipity when I told a story that I heard on her radio show in her presence. To this day, I cannot tell you why, of all the things I decided to do in this impromptu talent show, that was what I decided to do. I'm an artist.
Yeah.
I could have danced, I could have sang, but I decided to tell a story, and I decided to tell one of her stories, and she was there. So I'm a big believer in serendipity. I'm a big believer in the alignment of the universe, because only that could explain the choice that a 9-year-old made in that moment, one that was so consequential for my life, because it absolutely changed everything. I became a direct protege of Mama Mary. My first performance was at the top of the World Trade Center in downtown Baltimore at 10 years old with her. And it started a lifetime of dedication to the Black oral tradition of storytelling, one that I carry proudly because I get to say I am part of the direct lineage of Mary Carter Smith in the African oral tradition. And so she means a lot to me and my family. She is a grandmother figure. She is a spirit that still watches over us nearly 20 years after her transition. She is that sacred to me and to my family.
And in the TED Talk, you mentioned you cannot talk about your work without talking about her and her influence on you.
It would be an insult. It would be a lie. And so I uplift her, I uplift the Doctors Martin, because they are the reason I am who I am, aside from my parents, who I love very, very much. But I get to tell my story a lot. And as I continue to play it out, I also get to reflect on how I got here. And as a researcher, we know a little thing about correlation and causation, right? Relationships, but then the reason why something happens. I'm grateful that I can say the reason I am who I am are because of the people that I get to introduce the world to through my story. And Murray Carter Smith is definitely one of those people.
Just before our conversation today, we heard stories from the Facing Injustice in Health book, which was a facing project organized by the Source Center at Johns Hopkins University with support from Transform Mid-Atlantic. As the project came together, I was struck by the vulnerability and resiliency of the storytellers who talked about everyday impacts on barriers to care in Black, Brown, immigrant, and LGBTQ plus communities, and the willingness of them to share their stories to both educate and inspire. Your work is now at the intersection of public health and using storytelling as a tool for healing and justice. What was kind of the aha moment for you when you realized this intersection of your work could be used for social change?
It's something I've always had an opportunity to do, I think, based on the essence of Black storytelling. So me telling folk tales and sharing truths reflective of the African diaspora is an act of justice, because we know that in oppressive societies and suppressive societies, the first things they go for are the stories. They don't want people to know other truths that exist. And so as a child, I was engaging in justice just by preserving the tradition of Black storytelling. And it took another level, another quantum leap when I was able to see how that fit perfectly within public health. And to demonstrate that people telling their stories, whatever the stories may be, is not just an act of justice, it's an act of health. It is good for people's health to tell their stories. And so I go to my first year as a doctoral student at Johns Hopkins, where I took this course called Gaps and Opportunities in Public Mental Health, a systems approach. And unlike every other class that I was taking in my first year, it was an experiential course. It was a practicum as opposed to didactic learning. My instructor found out I was a storyteller, and she kind of crafted this unique project for me. Going to a recovery center in West Baltimore, people dealing with substance use disorder, opioid use disorder, alcohol use disorder, and teaching the client storytelling. What my mother and I quickly learned, who was also a storyteller and my partner in DiscoverME, RecoverME, is that we didn't need to teach the client storytelling. We just needed to create spaces for storytelling to occur, because the clients were already storytellers. Everyone's already a storyteller. We have to encourage and make space for intentional storytelling, where the magic sauce of that space is kind of what you alluded to, JR, vulnerability. Mutual vulnerability, and us as facilitators being just as open about our lives as those with whom we are facilitating a space. And that realization was, and I say this very intentional, it was a revelation, because it changed everything for me again. Right? It was abundantly clear to me that storytelling had a role to play in public health, and I wanted to explore that as much as I could. And I think it was a series of little moments where, even in an ivory tower like Johns Hopkins, even in a place that would seem very averse to anything outside of a very strict pedagogy or epistemology, there were people who saw something in storytelling that was enough to give me motivation to keep going. And so over time, I figured things out. I was able to build relationships, and those little moments became large experiences to say, yes, this is an act of justice. This is an act of health. This is what public health has been missing for a very, very long time. And I have a place and a capacity and a voice to introduce people to the possibilities, and they're embracing it. And that means something.
And you touched on this a bit, but generational trauma and systematic oppression can actually live in ourselves, right? And it's passed on. Like, systematic oppression becomes generational trauma. I'm sure you've seen time and again through your work how storytelling can help heal. Do you have a specific example or a story that you recall as someone where it was life-changing for them to go through this process? A story that stuck with you?
Yeah, so the story was an experience, and it was when my mother and I were first doing DiscoverME, RecoverME at that recovery center. It was called Recovery and Community. There was a gentleman who we were working with who had just returned from 26 years in prison.
Mm.
And I don't want to imagine what 26 years in prison must feel like. I don't even want to imagine 26 minutes, let alone 26 years. Understandably, the man was very quiet, not rude, not standoffish, but just quiet, kept to himself in our sessions. And the clinical supervisor with whom we worked at Recovery and Community let us know about the context so that we understood how to approach him. And so we always made space for him to tell his story if he wanted to. Oftentimes he was quiet. And then came a seemingly ordinary session where he spoke. We heard his voice. And you would have thought we won the lottery when he spoke, because it meant that much to us that he finally trusted us enough and everyone in the space to speak. And in subsequent weeks, he would speak a little bit more and a little bit more and a little bit more, to the point where he wouldn't shut up. He always had something to say, and we appreciated it as a release of all the stories that he wanted to share while he was incarcerated. When I'm sure out of survival, he had to be quiet. He had to be to himself as much as he could. And so that experience with that gentleman is one that I hold so dearly, because it speaks to this moving at the speed of trust. How else could this happen if we're asking people to be vulnerable and to share experiences about their lives that could hurt them all over again?
Yeah.
There was no incentive. There was no coercion. We simply made space for it, and he chose to tell his story. That means a lot, and gives me the constant reminder that, yes, anyone with enough time, moving at their speed of trust, can share their truth, and they will.
Yeah. And you speak about this intimacy in storytelling, that it's not just storytelling, but it's also a responsibility of a story listener, right? And that partnership between the two. And so I imagine when he went through this experience as a storyteller, and the vulnerability and the courage that he had to tell his story, part of it too was probably a process where maybe in a long while he had people listening to his voice too, as from a place of empowerment.
Absolutely. Story listening is the other side of the coin of storytelling. You can't have one without the other. And so anytime I talk about storytelling, I put the value on story listening right up there with the telling, that listening is intentional, right? We can hear if we're physically inclined to hear, right? But listening requires thought, right? The brain actually focusing on the teller of the story. And that's how you're able to internalize more of their message, internalize more of their truth. So we certainly recognize that there are people that need to go through the process of story listening before they get to a level of comfort with storytelling. And that's okay. There is no timeline that you can really put on this process. It moves as quickly or as slowly as it needs to. It's always right on time. And I think that's the faith that we have in storytelling, is that when the time comes for a person to tell their story, they'll tell their story. And there's always a good time to listen to someone's story.
I want to shift gears a little bit and talk about the health professional side and health justice and health injustice, right? Do you feel barriers to care for Black, Brown, and LGBTQIA plus communities is getting better? And or what would you say to other professionals who want to create a more inclusive environment?
That's where storytelling is such a valuable tool, and that's putting it, lightly, as a tool, is such a valuable element. Because through a person's story, if you give them the space to tell their truth, I do not think it will take that long for their humanity to be revealed. And if you're truly listening to their story, it won't take you long to have that humanity revealed to you and have the opportunity to accept it.
Mm-hmm.
Perhaps even embrace it. I'll take acceptance right now, right? Just give me acceptance. And then we can work on embracing it. And so everything that we're seeing in terms of injustice, disparities, oppression, suppression, comes down to, again, that fundamental belief, and it is a belief because we know factually it's not true. The belief that if you don't reflect my context completely, you are not equal to me. And look how much trouble it's caused us.
Mm-hmm.
Not just for those who are on one side of that oppression, but even the oppressors, right?
Yeah.
These are lessons that people are learning as we speak. And so you'd like to think that their conscience, whatever they want to call it, their better judgment will finally make it clear to them that they've been lied to. And those lies have not helped them in any way that they think it's helped them. And hopefully they're starting to see who's truly benefited from the lies.
Mm-hmm. One concerning point is that according to a July 2025 report from NPR, the Trump administration's Big Beautiful Bill will actually shrink access to healthcare for vulnerable populations, including the working poor, the elderly, rural communities, and the historically marginalized, among others. What do you say to folks at this time who might be losing hope?
Us learning these stories, us embracing these stories, this history is resistance. Us doing our part to institute change within our spaces, whether it's our family spaces, which is very important, within our community spaces, within institutions, within community organizations, and sure, within government to whichever levels we can achieve is possible. Our resistance is growing. Our resistance is building. People are learning the truth. And that gives me hope. The fact that we are having this conversation about storytelling and the process by which we got here, right? A book that highlighted the stories of the people done through Johns Hopkins University is how we got here. Mm-hmm. That gives me hope, right? Because a place like Johns Hopkins, which, yes, has had its involvement in much of what we've experienced in various ways, especially if we talk about the story of Baltimore, but we won't go there, is also seeing how storytelling has been missing in their practices, in their zeitgeist. And so I see this as a meaningful step that will lead to something better. I truly believe there is something beyond this. And I think we will get beyond this if we learn the lessons that this is meant to teach us. So to those who are feeling understandably despaired and hopeless, hope is not gone, right? It may feel dimmed, but it is not gone. And I can sincerely hope and pray and wish and put into the atmosphere that those who need to learn this lesson are learning, and that those who have always known this truth, despite our anger, despite our frustration, all justified, can see the opportunity to say, and now you can be on the right side of this history.
Mm-hmm. Dr. David Fakunle, Assistant Professor of Public and Allied Health at the Morgan State University School of Community Health and Policy, Associate Faculty in Mental Health at the Johns Hopkins Bloomberg School of Public Health, and co-founder and CEO of DiscoverME, RecoverME. Thank you for joining me today on the Facing Project.
Appreciate you, JL. Thank you for having me.
More about Dr. David Fakunle's work can be found online at discoverme.recoverme.com. Many thanks once again to my guests, Mindi Levin, Dr. Stéphie Dulièpre, and Dr. David Fakunle, and all of the storytellers and writers and voice actors who collaborated together to produce Facing Injustice in Health, a publication of the Facing Project Press with support from Transform Mid-Atlantic. More about starting a Facing Project in your community can be found at facingproject.com. To listen to past episodes of this program, visit indianapublicradio.org/The Facing Project, or find us on your favorite podcasting app, or on YouTube, or on the NPR network, or just ask your smart speaker to play The Facing Project on NPR. To continue the conversation about this episode, find us on Facebook and Instagram at Facing Project. The Facing Project is recorded at Indiana Public Radio at Ball State University in beautiful and wonderful and evergreen Muncie, Indiana. And it's produced by the amazing producer and audio engineer extraordinaire, Sean Ashcraft. The show is distributed nationally through PRX. I'm your host, J.R. Jamison. And until next time, I wish you the courage to share your own story and the empathy to listen to others.